Good afternoon from Yogyakarta. I think good morning from Abuja and also in Utrecht, yeah, Lawrence. That morning over there, yeah, and then good evening for Rachel in Melbourne. So it is a wonderful. It is wonderful meeting actually that we could meet each other in this virtual room, yeah, in the Zoom, yeah. During the pandemic, many things which is impossible to happen, but it actually happened. So this is one of the miracle of the pandemic that we could meet our colleagues from Africa, from Europe, and from Australia, for example, at the same time. So this is a really wonderful one. Actually, it was planned to involve another college of us, actually Dr. Claire Smith in University of York in UK, but she is now in not good condition of health and other activities, so she regretfully canceled her engagement, her participation in this wonderful seminar, or we call it webinar here because of this is web seminar. So I'm going to open this session by saying some introduction a little bit about the topic and maybe shortly about the situation in Indonesia and in global in general. Before then, we are coming to some discussion regarding the COVID pandemic, social crisis, and the challenges for exclusion. Yeah. Insight and lesson to learn from Australia, Nigeria, and the Netherlands. I think as we all know that the COVID-19 pandemic has been a global phenomena of public health crisis, which caused actually a variety of social crises in many parts of the world, including the increase of exclusion toward vulnerable groups such as poor people and minorities, and maybe gender and other issues. So the session actually aims to discuss and to elaborate some social impact caused by the pandemic and how to deal with them from different countries, from different continents. So this session, we will have actually 3 speakers. I will then give short introduction of these 2 wonderful speakers. First is Dr. Rachel Dipros, a long friend of mine. Thank you very much, Rachel, for joining with us in this seminar. Rachel is now a senior lecturer at the University of Melbourne, at the School of Social and Political Sciences. Yeah. She graduated from Oxford University some years ago, and she did research for her doctorate is actually comparing between Indonesia and Nigeria. So she is just a perfect person to talk about this topic, actually. Thank you so much, Rachel. Yeah. Rachel has been working long time in Indonesia since she was, I think, doing, his doctorate. You work for quite a long time with international agencies in Indonesia. After finish his PhD, he is still also engaged with some program in Indonesia, yeah, especially with REDD++ and so on. And she is now running some program she previously engaged with me in some research project. Actually, one of them is actually about frontiers, state and conflict in ASEAN Pacific, yeah, which is actually supported by University of Melbourne and another college. So Rachel will talk, I think, about the experiences of how Australia deal with the pandemic. Yeah, how we know, I think, many news regarding the how Melbourne, I think, strict particular policy in dealing with this problem. I think we need to learn a lot from there, from Australia, before we then move to Nigeria and Netherlands. But I think before starting to the first speaker, which is Rachel, I think I will give some actually overview of the situation of COVID in Indonesia and also in world in general. Yeah. Today we have, since I think the first case started in Wuhan in China, I think in late last year. Yeah. I think it's about in December in Wuhan. It started the case of COVID, and then Indonesia having the first case founded in Indonesia is in late March. In the world now, until today, we have totally 97.5 million cases of COVID in the world. According to the data, 44 million point 7 has been recovered. And then there is the number of people died by this pandemic is 1 million point 58 million. So this is, I think, one of the largest pandemic ever in the world. Yeah, before some experience in the past, in the long past, but this is, I think, in the 21st century. I think this is one of the largest pandemic. In Indonesia himself, we got now already the total cases is 500,093 593,000 cases throughout Indonesia. With the official number for the people died by the pandemic is 18.171. Of course, in our Indonesia cases, there are many numbers regarding this pandemic. So many people actually not confident that this is actually the real number. Some people, including some scholars, actually estimate that the real number could be double or even triple, even more. So this is actually really hits our country, as also happened with Australia and also with Netherlands and with Nigeria. So this is, I think, we have several problems in the very beginning, especially regarding how to deal with this pandemic, which is we didn't have experience on that. And also we have a trouble in making, let's say, coordination between government, especially after Indonesia applied a sort of what we call decentralization or local autonomy. So there are some problem in making coordination work between national government, with provincial one, and also with district one. So this is still a big issue until today. So by, let's say, giving kind of introduction of the problem in global, and then giving a sort of experiences of Indonesia during this pandemic. So we will, I think, start to move to the first speaker, yeah, Rachel Dipros, who will talk about how, I think, Australia deal with the COVID-19 pandemic. Time is yours, Rachel. I think about 20 minutes will be fine for you, yeah?
Thanks so much, Najib. It's wonderful to be here. Good morning to everybody, well, to Lawrence and students in the Netherlands. Good morning to Professor Kiari in Nigeria. Good afternoon, selamat siang, or sore, belum sore, to friends in Indonesia, and good evening to everybody else. It's great to be here, and I'm going to share some of Australia's experiences, but I imagine, in fact, that they're not that dissimilar to what's happening in other parts of the world. So just let me share my screen for a moment.
Yep.
And talk you through some of the things that have been going on. First of all, I think, and this is quite important to remember, because when we're thinking about policy responses and challenges, it is really important to take into account the structure, particularly of state authority, because they're probably best placed in collaboration with other leaders, community leaders, religious leaders, ethnic group leaders, and others, to respond to the pandemic, because there's often quite a lot of resources. But the structure of the state does matter in how we respond to problems of national and global and local significance. So in Australia, we're a federal system, which means that the majority of the powers, when Australia was first, I won't say formed, because Indigenous peoples have been here for tens, if not 20, if not hundreds of thousands of years. But when Australia was first colonised by the British, and eventually became a federation, we're still actually under the monarch of the UK, but more in sort of theory than in practice. But when we were federated in 1901, we had 6 states: Western Australia, Queensland, South Australia, New South Wales, Victoria, and Tasmania. And then we have a region called the Northern Territory, which you can see on this map here, as well as Canberra, the Australian Capital Territory, down in the middle of New South Wales. And the two territories do actually have they have a first minister and an elected government, but they do fall more within the authority of the federal central government. And that's what constitutes Australia. So when we were federated in 1901, the states were actually operating fairly independently, and they came together and transferred some powers for coordination to the federal government. And that really matters, because when it comes to a pandemic response, the states, which are similar to, for example, to states in Nigeria, or sort of to provinces in Indonesia, but in the case of Indonesia, the central government can always withdraw the powers of the provinces or the districts, and that can't happen in a federal system. So that means we have to come up with special ways of coordinating the pandemic response, and there is quite a significant role for the states in responding to the pandemic. We also had to change legislation. Normally, when parliamentary decisions are made, both in the federal parliament and in the states, the voting members of parliament to vote on a piece of legislation to pass the budgets which were needed for the emergency response for the pandemic, they have to be physically present, which wasn't possible with the pandemic, because we needed to socially isolate and we were all in lockdown. So they had to change the legislation to actually allow a certain core membership. There had to be a certain number of members still physically present in the parliament to pass legislation, but then a proportion could also dial in via digital forms. And so, but that required actually changes to our legislation to allow that to happen. The current status of the pandemic in Australia, we have a population of about 25 million people. We've been because we are geographically isolated and Australia is an island, that does give us a geographical advantage if our policy response was to really try and suppress the violence, really try and suppress the pandemic by closing our international borders. That's not a feasible policy option in many other countries, particularly in Europe, possibly also in parts of Africa and Southeast Asia, where you have many, many shared borders with countries. But we, being an island, we have ocean borders. However, we were reasonably successful back in March when we didn't quite respond fast enough. Quite a lot of cases came in through international travellers and had escaped into the community, which is why Australia in late March really locked down most of the country. Children were still allowed to go to school at that point, although a lot of parents kept their kids home. But most of the country went into lockdown in terms of working from home and trying to limit the amount of time spent outside and so on. Unfortunately, however, I'll come to what happened in Victoria a few months later. But this is our total case numbers. So we've had about 28,000 cases, which is actually quite a lot given the initial quite tough response. And as you'll see in a moment, most of those have been in Victoria. And we had about 908 deaths. And again, most of that was in Victoria, but we managed to stop that just in time before it really got out of control like it did in other countries. But one of the other things to note is look at these testing numbers. So this is the numbers from today, and we don't have many cases in Australia anymore. And yet we're still testing 37,000 people, and this is a small number. There was a point where we were testing 100,000 people a day because testing has been one of the key strategies of responding in Australia. But given that we're a federation, it really matters to have a look at the case numbers. And as you can see, the three largest states in Australia, Victoria, New South Wales and Queensland, actually had the highest numbers. And back in March, April, May, when we had our first lockdown, that was more or less Australia-wide, Victoria had much fewer numbers than New South Wales and even Queensland, and we were the last to come out. Victoria is where Melbourne is, so just let me show you the map. Victoria is down on the bottom, bottom left. And Melbourne is right down on the bottom left. You can see that's the capital of Victoria. And the two largest cities in Australia are Melbourne and Sydney. And understandably, that's where you're going to get the most cases. So back in when the pandemic first started to escalate across the globe, Victoria was actually doing better than some of the other states. However, we had a second wave. Very sadly, and numbers escalated very quickly. It was up to the numbers higher, same as London and other countries around, other cities around the globe that were being seriously infected. So that shows you what can happen when just a few cases get into the community. And the other couple of things to note is I assume these trends are quite similar in other countries. You can actually see this, this is the numbers from today, that while young people, sort of 20 to 29, 30 to 39, and 40 to 49 are more likely to get infected. When you have a look at the people who actually die, it's the aged population. And unfortunately, as has happened in many countries, the virus got into the old aged care homes, and that's part of the reason why there's quite a lot of aged care deaths. The main sources of infection in Australia were initially from people coming home from overseas or visitors coming from overseas, which is understandable because we assume that the virus, although it never can be sure, I guess, it came from somewhere possibly in Wuhan. But the other sources of infection were from escaped cases of hotel quarantine. So in Australia, once we closed the borders, somewhere in late March, early April, the government decided that anybody coming in from overseas, off planes or off ships, most of the flights and so on were cancelled. But for the few people that were trying to get home or allowed to come with special permission, you had to spend 2 weeks in a hotel in quarantine. You were not allowed to leave your room. Somehow a couple of cases escaped from hotel quarantine via cleaning staff or security guards. And they've been able to trace that because they can sequence the DNA of the virus back to the person that brought it in. So they can trace it and see how it travels through the community and know where it came from initially. So unfortunately, some of our most vulnerable people, which are people who have to work multiple jobs to survive, cleaners, security guards, they might have a daytime shift in a hotel and a nighttime shift somewhere else. They're the people who are taking public transport, because that's all that they can afford. That's how it transmitted from hotels into communities. And that's very, very sad because they're also a vulnerable part of our population. And what you can see here is what happened in the second wave in Australia. So we, just like every other country, we had this outbreak, but we managed to bring it under control in all of the states. But this big second peak that you can see here, 90% of that was in Victoria and mainly in Melbourne. So this reflects what happens when it escapes into community. However, what you can also see is that with the very, very tough lockdown that Melbourne went through, we had military around the city. We were not allowed to leave our homes. We were allowed to, one person from a household could go once a day briefly to buy food. And we're allowed out once a day for an hour for exercise. And that was the case for many months. But what it did was it brought the cases back down. And we actually have, we aimed for a strategy of what we call suppression, which is to try and get the numbers low and manage those numbers. But I think what has happened with the harsh lockdown in Victoria is we've eliminated community transmission, which was not the goal, but has been the outcome of the really long lockdown in Victoria. The other thing that happened was we closed our internal borders. So the borders between the states, between Victoria, between New South Wales, for the first time since the Spanish flu in the early 1900s, the borders in Australia, within Australia, were closed, which is quite extraordinary and a very, very big decision to make. And part of the reason that the government chose the goal of suppression rather than elimination, even though we seem to have eliminated it now, was because they were trying to balance the health and economic impacts. And this is one of the biggest struggles that all countries face, not just Australia. The other parts of the strategy, so let's think about this in terms of health first. What have we done in terms of health? Widespread and high levels of testing, high levels of testing, and then they trace every single contact from somebody who gets infected. Now, what's interesting is some of the research is saying that the health systems were able to track and trace everybody that got infected with everybody else they met and had contact with. They can do that as long as numbers of daily infections stay at about 40 in a particular state. So in Victoria, initially, when you have low numbers of cases, you can track and trace every person and stop the virus transferring to other people because you isolate those people that you trace. However, once the numbers go over 40 people per day in a state, the contact tracers start to get overwhelmed. And that's unfortunately what happened in Victoria. They weren't able to get a handle on it for a really long time. The government did a whole other heap of other things. This is particularly the federal government, although also a little bit of the state government, did pop-up testing clinics. So if they found that there was a possible outbreak in a particular part of a city or a particular town, like a suburb, they would set up testing clinics, and then many people in that little area would go and get tested, and that helped them to catch any cases that people didn't know they were infected, because not everybody has symptoms. They used a thing called telehealth. So for the first time in Australia, while some of the political parties had long been lobbying for what we call telehealth, which is where you dial in via Zoom or via FaceTime or via phone to your doctor, rather than going into the clinic or to the hospital. That stopped people having to take the risk to travel for standard health, not just for coronavirus. You obviously had to go and get a physical test for coronavirus, but telehealth stopped more transmission in healthcare providers where there was already infected people. And there's been investment in different trials now, but a lot of the research is showing, because we had such a harsh lockdown, people have lost their jobs. It's been pretty awful, that the mental health impacts is the greatest forthcoming risk of this pandemic in Australia. And it's partly as a result of the policy response of lockdown. So at the moment, initially they were trying to flatten the infection curve of coronavirus, and now the big concern is with the mental health curve, particularly for young people and people that have been locked down. And as I mentioned, in Victoria, in Melbourne, the city, a little bit in regional Victoria, but not for as long, these were the harshest lockdowns in the world. Not only did we have to do social distancing, masks outside of the home, the minute you walk out the door, were compulsory. The schools were closed. All the workplaces were closed except for essential services. And as I mentioned, really limited reasons to leave your home. We only had 4 reasons. And one of the other challenges was, part of the reason the virus was escalating really quickly in the second wave. So back in July, when it really got out of control and got up into the 700-800 cases a day, and a lot of people started dying. Part of that was the challenge of, we've got such a multi-ethnic community in Australia, and there's a lot of second language English speakers. So while the rules and regulations and policy response was clear in English, and it was everywhere, it was all over the news all day, every day, it was on the radio, television, social media, you name it, it wasn't in enough languages. So people with big families, were still having social contact with their families, not realizing that they weren't meant to. The economic impacts of the pandemic have been a huge set of job losses. I'll come back to this point I've made here about it being disguised by the JobKeeper program. Many people lost their jobs. A million people at least have joined what we call the welfare queue. So the government does provide some support for the poor. It's not very good, but it's still available. Within a few weeks of the pandemic and everybody losing their jobs, the whole internet system of the government's welfare site broke, because there were so many people trying to register. One thing that's important to note is there's been a policy over the last 10 to 20 years of reducing the amount of money for the poor. It's a political choice of particular governments, tend to be conservative governments. Reduce the money. In my view, you can't live on the poverty payments in Australia. It's almost impossible to live on those payments. And when suddenly 1 million or 2 million middle-class people, or people who are used to working, had to access welfare payments, it was going to be deeply embarrassing to the government, because they couldn't survive. So they increased temporarily at least, although apparently they're going to be decreased again, the amount of welfare payments as a part of the pandemic response. And they also did some cash transfers, a couple of cash transfers quite quickly to keep money flowing in the economy so that it would eventually, consumers would spend it and it would keep businesses propped up because of the great risk of closing businesses. And just like in many other countries, Indonesia, in Bali and Jogja and everywhere else, there's less tourism, hospitality because of our lockdowns. Cafes, food places, everything lost so much business, travel, obviously. And one of the worst ones, I think, was also arts and entertainment. So the theatre, the musicians, because everything was shut. We're not, because of social distancing, there is no cinemas. The cinemas were closed. All the performing arts were closed. And so again, that's millions and millions or billions of dollars in industry revenue, but also people's jobs. So the federal government. Yep.
Rachel, 3 minutes left.
Okay.
Yep.
Sure. So the federal government has responded by this thing called Job Seeker, which is our normal welfare payments, and Job Keeper. And Job Keeper was very interesting because they didn't want everybody to sign up for welfare, so they paid businesses directly to keep people in their jobs even if the business was closed. And that has meant our unemployment rate has not gone up. Some of the most vulnerable groups affected, however, first is Indigenous communities because of what you call morbidity risk factors. So unfortunately, there's very bad health conditions of the, it's the auto thing, very bad health conditions of the Indigenous community. If coronavirus got into that community, the death rate would have been very, very high. So all the states that had big Indigenous populations put very strict rules. You could not travel to Indigenous community areas, and a lot of Indigenous community members went home to their homelands so that they were protected. And the elders and community leaders moved very quickly to communicate really clearly. And we haven't had any transmission into Indigenous areas, which is amazing. I've mentioned a few of these groups, young people out of work and the impacts on the economy. There'll be no jobs available for them as they're looking for work. The aged, because it's such a high risk group. And just like everywhere else, the homeless in particular, because our rules were so strict that you weren't allowed to leave the house and you could be arrested or charged or fined. Suddenly all the homeless people were not only at risk of the virus, but also very precarious and potentially breaking the law. So all the governments put lots of homeless people into hotels, and it's now becoming an issue of that's not feasible over the long term. The impacts have been incredibly gendered, just like in Indonesia and probably in Europe. Women have borne the brunt of the care responsibilities. They're often in the precarious casual workforce, so have lost their jobs. Family violence has increased in the household, of which women are some of the greatest at risk. And women have been at the front line of the pandemic response because they're the teachers, child carers, and cleaners. But while the federal government hasn't had a very female-friendly response to the pandemic in Victoria, women have been at the centre of the response. So you can see all these vulnerable groups that I just mentioned. There's been an enormous effort to create job security for women and jobs for women. And secondly, the biggest ever investment in Australia the hugest investment ever in Australia in social housing for the poor and vulnerable and homeless. 12,000 affordable housing complexes are going to be built, which creates jobs and helps stimulate the economy as well. So hopefully things will improve. It was really tough for a while there, but we're lucky we have a few things in our favour, like, you know, being an island country and having had a fairly constructive government and community response to the pandemic. Thank you.
Thank you very much, Rachel DePros, for very, I think, comprehensive and deep review of how Australia responses to the pandemic. It's interesting actually to learn that from Australia, especially from Melbourne, where Rachel is now living. Although, yeah, Melbourne is, I think, the second largest city in Australia, if I'm not mistaken, right? And I think applying such a strict rule in dealing with the pandemic, what it's called kind of lockdown, yeah, for some time. I think it's interesting to see how it still have, I think, significant impact to different group of people, yeah, or Rachel call it vulnerable groups, such as indigenous, age communities, young people, casual workers, also homeless people, which is sometimes the problem in like urban area, such as Melbourne. So I think, thank you very much. Sorry. Okay, my stopwatch, sorry. Yes, but Rachel also pay attention to the issue of gender, how actually pandemic also having a particular type of impact, especially with strong influence, strong impact to the gender issue. And Mbak Rachel actually also now running another project on gender in Indonesia, I think large project with Mampu, yeah, with our colleague here from Visipol, Mbak Linda Safirani, and so on. So I think also very interesting to compare then later, yeah, regarding how its impact, the pandemic, I think impact both to Indonesia and Australia. Thank you very much, Rachel. So I think we'll move to the second speaker. So moving from Australia, we're going to move to Africa. We have here a prominent scholar from Nigeria, Professor Kyari Mohammed. He is now the Vice Chancellor. Let me check the data first, sorry. Professor Kyari Mohammed is a Nigerian academic born in June 1963. He is a professor of history and now currently the Vice Chancellor of the Nigerian Army University, BU, in Borno State. And previously, Professor Kyari, when I met him, I think last year or 2 years ago, yeah, Professor Kyari, he was, at the time, he was Vice Chancellor of Madibo Adama University of Technology, yeah, also located in Adamawa State. And that in the same university, in Madibo Adama University of Technology, Professor Kyari also previously served as chair for peace and security studies. So it's quite comparable actually with my center here, where I'm now, I think, holding this event actually from Center for Security and Peace Studies. It is very interesting actually to learn from Nigeria, maybe a little bit different from Mbak Rachel and also Mas Lawrence, who is basically Indonesianist. Their expertise is actually on Indonesia rather than in their own country, yeah, Mbak Rachel and Lawrence. But Professor Kyari is really expert on his own country. I know he contributed in one of edited book published by, I think, Oxford or Routledge publisher. So we want to learn from Professor Kyari how actually Nigerian country deal with this issue and how actually the impact of this pandemic in Nigeria, and how then state and also community deal with the problem, with the issue of pandemic in Nigeria. We are going to learn from Professor Kyari. I think it's about 20 minutes about the situation and insight and lesson to learn from Nigeria. Professor Chiari, time is yours. Your microphone, please. Yeah.
Hello, good morning.
Hey, morning
Okay.
from Nigeria,
yeah?
yeah?
Yeah, it's still morning in Nigeria. Thank you very much, Najib, and very much like Rachel introduced her on, there are many similarities, with Australia. And of course, there are also dissimilarities because
Yep.
COVID-19 is a global pandemic.
Yep.
And of course, the local responses vary from country to country and from community to community. And it also depends on the capacity of the individual states to respond and the gravity of the pandemic itself. Nigeria officially reported its first case of COVID-19 on the 27th of February 2020.
Okay.
So as at 9th of December 2020, there were reported 70,699 total confirmed cases for Nigeria. Out of which 65,242 were discharged, which means they recovered. The official records is 1,184 deaths so far. So for a country of an estimated 200 million, it's not relatively speaking, it's not too bad.
Yep.
Of course, every death, is one death too many, but it's not too bad.
Yep.
Now, there is a little bit of skepticism about the Nigerian records. For those of you who know Nigeria very well, Rachel inclusive, you and Lawrence have also been introduced, to Nigerian studies. But the record keeping is very poor because officially and unofficially, Nigeria really keeps records of sickness, death. Neither do our systems do postmortem. Some of these things are cultural. People will die, particularly in the Islamic northern parts of the country. People will quickly go and bury their death and come back. There is no official system of recording birth, death, or doing postmortem to know the cause of death. So this may be responsible for part of the low numbers. I'm speculating, I'm not sure. Two, the levels of testing is also low. The only time I got tested were when I had to travel out of the country about 2 weeks ago. So testing before embarkation is a requirement. Testing upon return is also a requirement. So you must have negative tests for you to travel, and you must have negative tests on re-entry. So there is no widespread community-based testing, and there is no program of testing. Then, of course, the poor health facility or capacity of the state in terms of health services. Nigerian health system was poor before COVID. So the fear around the world generally about COVID-19 is the ability of the existing health systems of the various countries to cope with the rising numbers. Now, the system in Nigeria could not cope before COVID. So if there had been, a large-scale COVID outbreak in Nigeria, as is being reported, in US, in Europe, and partly for Australia, then it will be, mass death, for a country like Nigeria. So we're lucky somehow to have survived. I don't know why, but then it's now, how did the state respond? State responses, are very similar to the situation painted for Australia. There was initially lockdown in Lagos and Abuja, the two cities where there were early reports. And states like Kaduna, where the lockdown, was fairly well enforced. But the lockdown lasted for somewhere around April, May, and June, in several. And because Nigeria is also a federal state, it varied from one state to the other. International borders were closed for foreign airlines. Local airports were also closed, particularly, as from the 27th of March until about sometime in June. Interstate travels, road travels were also, banned. So which means you could not move from, let's say, Borno State to Adamawa State, or from Lagos State, to Oyo State. Schools were closed, all schools, from tertiary institutions, to kindergartens. Mosques and churches were also closed. Workers, low-level workers, from the lowest level to about mid-level, were told to stay at home, while very senior level brokers were allowed to come to work. The idea was to reduce, interaction, intermingling, and maybe impose social distance and so on and so forth. So all the known COVID protocols of washing hands, social distancing, and face masks, were imposed. So you couldn't go into any official business without wearing the face masks. You could not go anywhere without to large gathering. Even when the lockdown was eased, in many places, there will be no gathering of a maximum of more than 50 people. And in some states like Lagos, some breaches were also punished. But in several other places, there was no punishment for breach. Now, the community response was first a lack of belief, and then it moved from lack of belief to, maybe COVID may be real, and then when they started seeing the death, then the numbers, increasing, and maybe every now and then, many people have seen people who had been afflicted with COVID, then there was something, so this thing could be true. And this lack of belief was, we first started with the religious leaders. A very prominent Salafi scholar in northern Nigeria, based in Jos, was the first to say, no, this COVID thing cannot be true. If COVID is true, as people are saying, how come we have not been seeing people, dying by the roadside? So what the state did was, Nigeria is a democracy, but it's also a police state, so he was taken into custody, quote unquote briefed, and then later on now he changed his narrative to, people should take care, this thing, really exists, and so on and so forth. So gradually, religious leaders were implored to please, change your narratives, so that you do not endanger the lives of your congregation and the larger community. And very much like Indonesia, in Nigeria, people listen to the religious leaders. They are influencers, of public thought and opinion, and so on and so forth. So, what are the challenges? The number one challenge was the generalized insecurity around the country. Now, COVID came and made a situation where for 10 years, there was a raging insurgency in the northeastern part of the country, which had claimed lives again of somewhere minimum of 30,000 since 2009, and it could be as much as 100,000 people. It has displaced over 2 million people as IDPs, internally displaced persons, over 200,000 as refugees, in Niger, Chad, and Cameroon. And of course, I'm talking of the Boko Haram, crisis in the northeast. In the northwestern part of the country, Nigeria is still battling rising local banditry, characterized by kidnapping, cattle rustling, and depredations on rural communities. The crisis of successionist tendencies in southern parts of the country, particularly by the indigenous people of Biafra, has not abated. The crisis in the Niger Delta about resource control, over control about oil, and responses to pollution by oil companies in the Niger Delta has not been completely settled. Ethnic violence, religious violence in places central Nigeria, southern Kaduna, Benue, parts of Plateau, is still ongoing. So COVID, was imposed on an underlying situation of tension and crisis. This is further, exacerbated by bad governance. So there's a lot of anger around the country about bad governance, structural inequalities in society. So you have a situation of poor infrastructure, poor and dilapidated infrastructure due to discontinuities in governance. Each government will want to start its own program without continuing the program of the previous government. Then Nigeria itself lost a lot of money from oil revenues because of the crash of the oil price internationally. So you had a situation where issues come in to meet declining income, for the government. And then there's a lot of anger about this was a government that came in 2015, promising manna from heaven, and suddenly the situation seemed to have gotten worse, and so on and so forth. Of course, I've talked about the collapsed health system. There's a general declining trust in government by Nigerians. And Nigerians are a very skeptical people in the best of times. So these are some of the general problems that have gone on. Nigeria has a very large youth bulge. 60% of Nigeria's population are young people, mostly below the age of 35. Most of them unemployed. So this is also another problem. So what COVID did was to increase the hardship, especially for the vulnerable groups. It also led to job losses in entertainment, in tourism, local airline industries. They had to, in fact, sack even pilots, and several of them, even after the reopening, cannot come back because of high operating costs. Now, there is no welfare system or safety net in Nigeria. So if you lose completely. So this is also part of the anger. As a result, there's increased violence, urban violence, crime and criminality, banditry and depredations in the rural areas. There's a general sense of, despair. You may have heard of, in October, of the urban uprising in places like Lagos called the NSAS movement, which is a mimicking of something like the Black Lives Matter in the US, an attempt to use the power of the social media to organize young people, and protest. So in the particular case of Nigeria, the NSAS movement, SARS in Nigeria meaning Special Anti-Robbery Squad, a special unit of the Nigerian police, similar to the SWAT in the US, which was established in the 90s specifically to combat rising urban violence, armed robbery, and crime. Now, they became very notorious for human rights abuses, for extortion, bribery, and so on and so forth. So the NSAS movement basically was an attempt, a reaction to increased police brutality. And they made some demands on government, one of which was to scrap that police outfit called the SARS. Then they asked for justice for victims of police brutality. Then, of course, they asked for respect for human rights and deepening of democracy within the country. They also demanded for a revival of the health and educational systems in the country. They asked for more jobs. So from a single point demand of scrap police brutality or the unit responsible for police brutality, they continued to increase their demand as the government also kept in. After 1 week of protest, government said, okay, we've scrapped that police unit that you don't like. And then new demands came in. This, of course, led to, from a peaceful protest, social media protests, young persons waving Nigerian flags, singing, suddenly it moved into jailbreaks, burning of television stations and newspaper houses that were not reporting correctly, sometimes attacking politicians for no apparent reason that I can explain. And some policemen were also killed. And of course, Nigerian military was deployed and some peaceful protesters were also killed. So you have a situation where there were killings on government side. There were also, believably, some killings by some protesters, although the protesters believe they were infiltrated, and so on and so forth. So there's a commission of inquiry that is ongoing to unravel, some of these things. So the government's response to the NSAS was basically, okay, we'll scrap the unit you don't like. Then, of course, it was forcefully stopped. What are the lessons for Nigeria of the COVID pandemic and also the government's response, the NSAS protest, and how it ended? Basically, one of the things that the COVID-19 did was to expose the soft underbelly of the Nigerian state, show the state's incapacity and fragility. The protest has clearly shown that if Nigerian citizens organize very well, they can change the destiny of their own country and they can make demands of elected officials. And elected officials in Nigeria are notorious for their lack of accountability and impunity. One of the other lessons is it exposed the poor health and educational facilities and infrastructure, of the country. For those of you who have done research in Nigeria, who have moved around in Nigeria, it is clear, the poor level of infrastructure, in the Nigerian state. Every person will have to make provision for his education of his children, for medical facilities of your spouse and children. You probably will have to be your own municipal service by providing water and electricity, so it further exposed. It also showed, like I said earlier, the lack of a safety net. If you lose job, there's no welfare scheme. There is no scheme to also keep people in business. So it showed the predisposition of the Nigerian state to violence, at the slightest provocation. There is no dispute resolution mechanism other than sending either the police, or the army, to crush even legitimate protests. It also showed that in Nigeria, with the COVID pandemic, all Nigerians are on the same boat, meaning whether you are a high-level government official, or you are a peasant in the village, or you are a menial worker in a factory, it meant that if you get entangled with COVID, chances are you may die because the health system does not exist. And this was shown by the first high-profile death which was of the chief of staff to the president of the Federal Republic of Nigeria, who died of COVID complications. He was the first high-profile death. And of course, there have been subsequent deaths of high-profile, people within the Nigerian state. So basically, our experience is similar. No, I can see you are trying to stop me. Basically, our experience is similar to that of Australia in many respects. So thank you very much.
Najib, your microphone is off.
Thank you very much, Lawrence. Thank you very much, Professor Chiari, for explaining the situation, the problem of pandemic in Nigeria and how state and communities actually responded to that issue. Quite similar to Australia, actually, Nigeria also federal state, even with the number of population is larger than Australia, about 200 million, yeah, Professor Chiari. And the number of cases is relatively low, although there is some doubt regarding the data, the number, and also the problem such as the level of tests, which is also quite low, which is also comparable to Indonesia in general. There are some problems related with in particular with Nigeria, such as in some areas there is a problem of security with the existence of radical groups such as Boko Haram. And there are also some problem related with, let's say, like such as local banditry in some areas. Also problem of bad governance, quite prominent. Also the issue of inequality, social inequality, which is actually making the problem in Nigeria actually become really challenging. So I think we are going to discuss further about some issue related with this with the story from Nigeria, and then we are going to move to Netherlands. But before moving to Netherlands, I think I'm going to greet some college and student coming here. I think I found some college such as Pak Mardimen from Salatiga, Professor Priyambudi from Flinders University, Australia. And then there is also Pak Ridho from Palembang and Pak Rianto from Tanjung Pinang, I think, yeah. And there are many students also from Amsterdam, also students from, I think, Gajah Mada. I think we are going to listen to your comment further in the discussion session. And then we are going to move to the next speaker. Sorry. Dr. Lawrence Becker. He is associate professor in the University of Amsterdam. Lawrence conducted his doctorate in Radboud University of Netherlands on the issue of land issues and land conflict in Indonesia. Lawrence also conducted many research in Indonesia and also in Nigeria. So quite similar with Rachel, actually, Lawrence having knowledgeable person on these two countries, on the Indonesia and also in Nigeria. And we are going to listen from him about the story, about the experiences from Netherlands. Lawrence is now just finished coordinated research project comparing Indonesia, Nigeria, and Kenya on the role of non-state security group, where actually I personally involved with the project. We just finished last year, Lawrence, I think, yeah, the end of last year, yeah. So it is, I think, very interesting to learn from Amsterdam, who is now also applying what it's called, I think, intelligence lockdown. At least from the point of view of government, they call it intelligence lockdown. I think it's quite different from, I think, Indonesia, which is not intelligence enough, at least in some areas. And we actually, Indonesia also just conducted what we call Pilkada Serentak, yeah, our local election. I think massive and local election in the same time in many areas of Indonesia. I think in 270 areas of Indonesia just conducted local election. So we are still, some people is now still concerned about the new cluster emerge from this election, but we still, I think, looking for the next maybe few days or weeks. So I think I will give opportunity then to Lauren to tell the story from Netherlands, how Netherlands communities and state deal with the problem of COVID pandemic. Time is yours, Lawrence.
Okay, thanks very much, Najib. Well, good morning to those of you who are in the same time zone as I am. Good afternoon to people in Indonesia and good evening to those in Australia. Allow me to share my screen briefly. I was wondering, listening to the presentations by Rachel and Professor Chiari, whether I would actually have anything new to bring to the table, but I actually believe that I do. Because interestingly enough, there are lots of similarities, but there are also quite a couple of differences between the situations as we have heard so far. So basically, I'll be discussing what's going on in the Netherlands, partly from my own perspective or my own experiences, if you like, which are those of an academic working in a university, in which lots of changes have been taking place. And I will also focus a bit more on societal reactions in general, because those are really quite visible over here. So basically, just a little bit on background on what's been going on here. As said, we've also had lockdowns, by far not as stringent as the ones in Australia, I believe. And for that, it's probably good to keep in mind that the Netherlands are a fairly small country. It's mostly urban, which means that you got a lot of people in quite close vicinity to one another. Some people compare notably the western part of it, which is also known as Randstad, which would mean city at the edge, if you like. But it's basically because although it's a quite large number of smaller and larger cities, they pretty much all connect. So if you like, the west of it is one large urban area, which means lots of people close together, lots of contacts. So what happened here is that in February, about a year ago almost now, the first case took place. In March, unrest was starting up, people were getting worried. One of the major things here was that the Eurovision Song Festival, which would have been held in Rotterdam, was actually cancelled, which to some people brought across the measure that, whoa, this is actually a serious thing. And what started happening was that people started to stock up on supplies. Government particularly telling them, don't do that because it's not going to be necessary, but particularly dry goods, rice, pasta, toilet paper for some reason were those things that people bought and stocked up. So actually there were these interesting images in the media of empty
toilet paper.
Shops. Yeah, and empty toilet paper parts, and which of course created further unrest, because why is it empty and what's going to happen next? Basically, end of March, the Netherlands went to what was put out as an intelligent lockdown, which means that there was no full lockdown, but that lockdown was put in a more precise, chirurgical, if you like, way of using it, which meant that a lot of different types of shops, but also professions, all closed for some time. But basically that others at some point were allowed to reopen again. And that went fairly quickly. So for instance, the first couple of weeks, if you like, hairdressers, for instance, beauticians and so on were all supposed to close, and they were all closed. I mean, I live on top of a mall, and downstairs was really like a ghost town for that time. All the shops were closed, nobody was there. Very interesting, very different from what it usually is like. But of course, if all those people need to stay home, as we've also heard from Rachel and Chiari, that's disastrous for the economy. So that's one of the reasons why government here believes like, well, maybe we can make this a bit more specific, and at some point we can have them open up again as soon as possible. Which is basically what happened. After some time of this intelligent lockdown and stay-at-home procedure, hairdressers were allowed to open again, shops were opening up again. There's a somewhat stringent access policy, meaning that you cannot just walk into a shop. Quite often you need to check how many people there are first and you will be let in. Same for a hairdresser. You officially cannot walk in, you need to have an appointment, but in practice you can just go there and say like, oh, do you have time? And then you can have an appointment on the spot. So during summer, notably, measures were eased. And in that time, the number of cases, well, was relatively stable, if you like, did not disappear, but did not go up too much. But as notably from October onwards, measures were put back in place again. And at the moment, we are in a situation which is less of a lockdown than it was in March, but it's still quite stringent. Notably, all the hospitality industry is closed and very much protesting against that. So the restaurants, the bars, the theaters are largely closed. Not all of them, actually. Shops are open, but we actually only have had a face cover, a compulsory wearing of face covers only from 2 weeks ago, the 1st of December. Before that, it was compulsory in public transport, but in shops and the streets, everywhere, it was a personal choice, if you like. Just to put a bit of numbers to it, well, at the moment, the Netherlands has a population of just below 17.5 million. The total numbers of cases as up to last week was well, getting close to 600,000. And I say known cases because there's a policy if people may have gotten it, but if they did not go to a doctor or did not get themselves checked, then it's likely that, of course, it went undetected. So the idea is that there may actually be more people who have gotten infected, but who did not experience any problems and therefore did not report it. So far, about 18,000 people have been hospitalized, and well, we're getting close to 10,000 people who passed away over the year as a result of COVID. But perhaps also to echo what Professor Chiari said on that, of course, each death is one too many, but if you compare it to the size of the population and to the way in which the population is living in fairly close vicinity to one another, the total death toll at the moment is actually not that high. Now, living with this and living with these measures, of course, has some serious impacts. And I just wanted to emphasize that a little bit by showing you a picture of our university building. This is, well, amongst others, my faculty. And this is how it pretty much looks at the moment. It's empty. You can go there to study. You can even, as staff, go and work there if you apply for it and if you follow very stringent rules. But I was there 2 days ago. It's really quite deserted. There's nothing going on there. All teaching is via Zoom, and all meetings, staff considerations, seminar are all the same way. I think Najib already mentioned some of my students are at the seminar. Most of these students have never seen me in real life, so they can't actually really prove that I'm a human being. For the same, I could just as well just be some computer construction, basically, because and the same goes for them. I've never seen them. So strictly speaking, I can't be sure that they actually exist. Which means also for students that life is completely different. I mean, it used to be like this, full classrooms, of course, and we have a bit of teaching on site that is starting up now, but not in these ways. You need the different kinds of distance that need to be maintained. So groups of more than 30 are pretty much impossible. So if you have a class of 200 students, they can come to class, well, perhaps once every month, which isn't a lot, obviously. And also quite importantly, notably when all of this began, students were often being perceived as a source for the spread of COVID, particularly because students tend to live in student houses, like what you see in the picture here, which means one person per room. They were supposed to have parties. They were supposed to not take measures so stringently because they were young and were not so impacted. And whether all that was true is actually fairly questionable. I know quite a lot of students who took this actually rather seriously and really kept distancing, but they were, if you like, really put on the spot as being a group responsible for spreading. And one element, by the way, which also probably made life fairly hard, is that initially policy said that you could move around or be in one place if you were a household, meaning you, your spouse, your children, that would count as one group that's acceptable. Students, even though they live like this, in a house, share a kitchen, share a bathroom, and so on, would not be considered a household, which meant, of course, that it's got into a rather complicated situation, for instance, during the summer, which was rather warm. Students could not sit on the porch of their house. Well, they could, but then if police or someone else would come by, would check them, they would not be a household and would not be allowed to sit there and could get fined. That's altered now, but it was a very strange situation in that way. And basically measures in the Netherlands that's probably caused by this intelligent element of the lockdown, in a sense, were very confusing. Most contact sports, for instance, were forbidden, but if you would be taking dancing classes, you could go on. You were not supposed to take public transport, but if it would be a shared car, that would be fine initially. And of course, I think a lot of the way in which these measures worked had to do with them simply not being crystallized sufficiently to deal with all the various situations. But some rather strange situations occurred as a result. Generally speaking, face masks was one of those. The discussion started fairly quickly. Should we have face masks, yes or no? And then the question was, what sort of face masks and where do you get them? And I mean, it led to interesting and creative forms of those. But actually, the discussion is still going on. As I mentioned, we've just had them made compulsory 2 weeks ago. Well, for an epidemic that's on a global scale and has been going on for almost a year, that's not very quick. Another important element, which maybe hasn't been mentioned that much as yet, I think, is the role of jokes and the role of humor in all of this. I mean, people couldn't go anywhere, so they mostly stayed at home, but at least my WhatsApp and my email tended to explode with all sorts of cartoons and funny movies and Corona-inspired things. And it turns out actually it's being put to the fore more often that humor is an important way for people to deal with, let's say, disadvantages or problematic situations in their life. So personally, I've been keeping a bit of track also on how many of these things I receive. And it turns out somewhat that as more cases become known, the amount of jokes also increases. Whereas if it quiets down, there are also less jokes that reach me. So there might be some interesting way of dealing with COVID that is going on, at least here in this relation. On the whole, I think it's interesting to discern that you could say that there are two directions going on in society. I think most people certainly are dealing with it as well as they can. They are observing the rules. They are supporting people in need, like their neighbors, family members, and so on, and keeping up a fairly disciplined life, if you like. On the other hand, however, there's also you could call it a protest movement is perhaps a bit of a big word, but there are protests and criticism as to the effectiveness of various measures. I just mentioned the hospitality industry, restaurants, bars who have been closed for quite a long time. They are really very vocal in that there is no point in closing them down if you keep the supermarkets open or the other shops. And they have really been trying to force, if you like, reopening, going to court, and actually they're threatening now that even if we can't, we will reopen in January, because otherwise we all go bankrupt, and that just doesn't work. There's also a more visible, if you like, discourse of Corona being fraud, which comes through notably in social media online, but also is being put forward by some members of parliament. So there is this counter discourse going on, and occasionally you get these public appearances of protesters, let's, for instance, like this group. You don't see that much of it. It doesn't happen that often, but actually it seems that Corona and Corona protests are kind of like a way for people to let off steam in a way, and it's also something that's been picked up by other groups like anti-5G, protesting farmers, fun fairs being closed down, so you had protests and anti-Corona measures by the owners of fun fairs, obviously by the hospitality industry, by the building industry. Anti-vax movements start joined within this, and while they're still not very large protests, they are taking place fairly regularly. And what's often is that they often use national symbols, flags, and so on, but then use the flag the wrong way around, to put it that way, to show that it's definitely not how things should be. But overall, as I said, many people, even though they don't agree with the regulations or find them weird, tend to follow them up. And that also means that slowly by now there is quite some annoyance, I think, in society. Patience is running out. Patience with government that is not able to tackle what's going on. Patience with people who do not stick to the measures and might potentially spread the virus. Like, again, I mentioned the mall downstairs. You're supposed to walk on the right side if you walk through it, not on the left. Quite often people still walk on the left, probably carelessness, but you see the ways in which other people look at that and are annoyed by those people who potentially may spread that virus. Oh yeah.
3 minutes left, Lawrence.
We shall, thank you. I just put in this picture to show you one thing. This happened notably in spring, that people would use cranes and all sorts of building equipment to go and visit the elderly because they could not enter the homes. So they would visit them from outside. And if they would be living on the 3rd or 4th floor, crane companies would step in, set out a crane for a day, for instance, to make these visits possible. So basically, what does all of this mean? In the Netherlands, has been going for some time by the name of Nieuwe Normaal, which means the new normal. And I think by now you can almost start calling it normal because it's not very new anymore. But I think in general, people are patiently enduring what's going on. They're coping well. They're in support of government politics. What may or may not happen is that COVID brings about changes in the way in which the economy and society are run. But one important thing is that when these vaccines will become available, which is likely to be next month or so, is that by now also there's as I said, there is quite some distrust against them. There's a popular poll that's being run every month, asking people whether they will take vaccines or not. There's a fairly large minority, I think it was about 40%, which either doubts or says they're not going to take those. And it's partly based on this notion that they won't be effective, or that these vaccines are actually there to not so much protect against corona, but to do something else. For instance, and I'll promise I will shut up shortly, but let me just show you today's newspaper for a minute. No, sorry, can't show it. It's not there for some reason. Anyway, what I was going to show you is an interesting article, which basically is putting forward. Oh, of course it's there. Sorry. Here, today's newspaper. That's thousands of therapists have been given disinformation as to corona during compulsory additional education. And then basically, if you read the article, it will tell you that this disinformation consists of the notion that actually the vaccine may be there to make for better people, rather than simply being a vaccine against a virus. So there is, a strong undertone of distrust that is part of the debate and part of the considerations. That is probably something that should be taken into account. And that also perhaps ties into the lack of visibility of corona. So corona basically as a myth, in the sense that indeed you do not see people dying from corona or lying dead at the side of the road. And I think that's fortunate. But it also means, of course, that if there's no proof, if you like, it makes it easier for people to distrust the existence of such a virus, and the idea that actually what's going on is that the measures are there to increase the grip of government on society and on the economy. And I'll stop there. Thank you.
Thank you very much, Lawrence Becker, for very interesting presentation from the stories, from the cases, from the experiences from the Netherlands, especially on how people, how community actually responds to the pandemic. I think a very interesting story from there, from the different cases of what he called actually like stress in society, one of the issue, and how then jokes, humor become a way to deal with the problem, with the issue, and also a big problem I think the significant number of actually distrust regarding the first about the pandemic himself, about the COVID himself, but also how toward how government or state deal with this issue. I think this is very interesting issue to emerge in this discussion, to come up in the discussion. I got already some responses from the box. You can see over there. I wonder if Mbak Arifa, you want to say something or to ask yourself your question, or just me reading their question.
Just please read the question.
Hello? Okay.
Pak Najib,
I think,
just read
yes,
it.
okay,
I'm listening. Thank you.
Okay, thank you, Mbak Arifa. So I think Mbak Arifa raised two questions at least. One to Rachel regarding women agency in dealing with the pandemic. Is there any emerging new woman agency in terms of solidarity and taking care toward others among women as well as other vulnerable group? So this is a question from Mbak Arifa to Rachel. And then for Professor Chiari, because Professor Chiari actually gives some attention to the issue of conflict. Actually, so Mbak Arifa wonder about that issue. Is there whether the COVID escalate or de-escalate the conflict in the state, such as Jaws or other, and how then the COVID shift the power contestation in Nigeria in general. So I think this is, very interesting issue. And then from my college, from Dr. Riza Taqwa, actually a sociologist from Universitas Unsri Palembang. This is a question to you all, to all speakers. Is there a mass vaccination plan from local government? If there, how the policy and how the, let's say, responses from public, especially social scientists, toward the plan for mass vaccination by government? And then also another question for all speakers by Mbak Rofiana from UMBA. Thank you for the explain. There are similar conditions in your country with the situation in Indonesia. The question is actually about what is the vaccine as well. How the plan for using the vaccine, yeah, to stop the pandemic, let's say. What is the plan from your each country? How your country make choices? For example, like Indonesia, we have some deal with China, but also we have some alternative arrangement with the UK and other countries. So, but Roviana basically asking about this issue, about the, let's say, technicalities of vaccination. And finally, from Pak Mardimin, yeah, this is actually about the lockdown, also comparing Indonesia with Melbourne, while the lockdown never been applied actually in Indonesia, but he actually wonder, Rachel especially, how is lockdown program implemented in Australia? Does the government provide guarantees for meeting household needs during the lockdown? Please, so I think we will start with Rachel, because actually it's getting late in Melbourne. So I will give first opportunity to Rachel to respond to some question, especially toward him, but also some general question from audiences.
Okay,
Your turn,
thanks.
Rachel.
And thanks for the great questions. They're really insightful. So a couple of things that relate to the answer in these questions in general. There was two aspects which Lawrence and Pak Chiari, I called you Pak because I'm thinking you're in Indonesia, Professor Chiari, had mentioned, you know, which I didn't focus on. And so I think they're really important to note the synergies actually. There were small pockets in Australia of people that that did protest and did clash with the state and did face a fairly strong lockdown. But in general, people were trusting of the state and fairly happy with the response. And secondly, I'll come back to some of the similarities with the Netherlands in a moment, which comes to this question of from Mardimin, you know, did the government provide the guarantees for meeting household needs during the lockdown? And I think you could say in general, yes. And they did this in multiple ways. So I showed you on the presentation, we have a welfare system, a social protection system where you can get unemployment benefits, or if you can't work because you're disabled or have an illness or something like that. There's not very much money. And I think they did two things. One, they did an additional cash transfer. They've done 2 one-off payments, and they increased the amount that was available so that it could meet basic needs. And the challenge is that I think when you've been unemployed for a significant period of time, with such a small welfare payment, and sometimes I wonder that the Indonesian one's actually more generous relative to the cost of living. Australia, it's a higher amount compared to Indonesia, but the cost of living is also higher. Because so many people lost their jobs and the welfare payment is so small. Like I said, it was embarrassing and it wasn't livable. So they increased it and they did 2 additional cash payments. Now, that is not to say that there are people that still fall out of the system. And this is where I think Indonesia's done a very interesting and unique response with your cash transfer system through the Dana Desa or the Village Fund, where if you weren't registered for the formal payments through the social protection system, in the poverty cards and the family cards and so on, because you were too poor to be captured by the system. That happens a lot in Australia too. Your response has been excellent because you could use the 3 tick, like 3 people verifying that you're poor and then access the emergency transfers. We didn't have something like that in Australia. So I'm not convinced that it captured everybody. And yes, but people are very, you know, businesses are dissatisfied with the long lockdown. It's not uncontroversial, but in general, Australians put their health first. And there was a lot of clear communication. The rules were strict and they were enforced, but they were communicated and explained. And that's possibly the difference also with Indonesia, it's sort of, sometimes there was lockdown, but there was still restaurants and cafes open. You know, there was please socially distance. For us, that wasn't even an option. The second question on what's going on with the I'm just going backwards up the list, and I'll end on the gender question. What's going on with the vaccines? Australia, I don't think we've invested in the China vaccine. I don't think there's a reason for that at least is a public reason. It was one of, I think it might have been one of the later vaccines, but we are investing in 4 different ones from different countries. So there's support for the one from the UK, there's the support for the one from the US, there was support for the one from Australia, and another one that I can't remember where it's from. The point is that they supported lots of vaccine development because not all of them will come about and sort of guaranteed to buy a certain number of doses. It's very tricky at the moment. I won't go into the Australia-China relationship. That's not my field and it's very controversial, but the relations are not great at the moment. Partly, it's a long story, but partly triggered by Australia wanting to lead the investigation into the source of the virus, which hasn't made China very happy. The third question around one other point I also wanted to make in relation to what Lawrence was saying, all of those things, all of those risks in the Netherlands around aged care, mental health, I didn't get enough chance to go into those, the isolation of the aged care, the growing humour, the memes, the the different ways that people are trying to interact. That's a very similar story here in Australia too. The empty streets, the closed cafes, the enforced social distancing, all of those things are also happening. In coming to the question around the pandemic in Melbourne and women's agency and solidarity, that is such an interesting question. And I've been sitting here for the last half an hour while I was listening to Lawrence and trying to reflect on, has there been, because I look at this in Indonesia all the time because of the nature of the way people mobilize and how strong community and civil society organizations are in Indonesia. They're a fundamental part of the functioning of Indonesia in the democratic era. Now, they are a fundamental part of the functioning in Australia too, but they tend to be much more formalized and sort of more like institutes. So how do you identify if women's agency and solidarity is coming about? I think I could say, yes, that is happening, but it may not be the women's movement on X. I mean, there's been a huge response to the federal government's budget. So I showed you very briefly the federal government's budget, and there's a lot of economic stimulus, but it's been deeply criticised because there was no support for women, and they are both experiencing the greatest impact of the pandemic in terms of so many different ways. I showed you all those different ways that women affected, and yet you couldn't point to anything in the federal budget response to the pandemic that helped women. But you could in the States because the federal government came under so much criticism. So that criticism in and of itself is and it was coming from many different quarters of civil society and from the political parties. So that is one aspect. But the other aspect, I think you could delineate sort of from employment sectors. So you can't say there's the women's movement of whatever, but certainly teachers and nurses, like that's where you see the agency and the solidarity. Songs have been made. The entire staff of hospitals have made inspiring songs, sort of like they have in the UK, where everybody comes out and bangs their pots and pans for the health workers. And because so many of those health workers are women, from a sectoral perspective, you could say they are driving a lot of the innovation and the care and so on, just like they are in Indonesia. Lots of small businesses suddenly making masks, all on Etsy, just like you would have in Indonesia. And that's a lot of women because they're working from home with care responsibilities. So I guess in many, and I think the solidarity is coming about by highly identifying the gendered impacts of the pandemic and making sure in all the private sector organisations, in state institutions, in universities, calling out the fact when policies aren't being gender sensitive. And I've seen that increasingly in recent months. I'll stop there. Did I miss any questions? I think I got them all. I've got all the ones that are written.
Yeah.
Yeah.
I think that's all. Rachel, thank you very much.
Thank you.
Thank you. Thank you so much. We move to Professor Chiari, please. Your time, Professor Chiari.
Yes, thank you very much. My own questions are, first, the question is whether COVID escalated conflict in conflict areas.
Right.
The simple answer to that is no, the conflict itself did not escalate as a result of COVID. However, some disadvantaged groups were further disempowered as a result, of government attention being shifted away from supporting those groups. I made mention of some 7.9 million people in the conflict-affected areas of the Northeast depending on life-saving support, mostly from humanitarian agencies, such as the UN agencies, Médecins Sans Frontières, Mercy Corps, and all of these international NGOs. Now, this is made up of 2.5 million girls, 2.2 million boys, 1.7 million women, and 1.5 million men. So you can see the disparity in terms of young persons as against old persons, and the disproportionate number of girls and women. Now, 3.2 million of these people are living in host communities. So they are not in the IDP camps, they are not supported by government. Now, 1.9 million of these are internally displaced persons, either living in camps or living in host communities. 2.1 million of these are children under the age of 5. 900,000 are people with disabilities. So what it did was, even the sources of funds for the aid agencies is no longer as forthcoming as it used to be as a result of problems of their funding agencies, the donor countries, so everyone is looking into, look, we have a problem at home, we are going to, so there's some form of donor fatigue, which has also affected the support given to some of these groups. So the conflict itself has not escalated. Fortunately, there doesn't seem to be community transmission in conflict areas. If there is one, it has not been reported. So other than just the disproportion of the weak and vulnerable, I don't think the conflict itself has done anything. Now, the next question will be whether the conflict also did exacerbate and widen power relations between groups. In terms of politics, I'm not sure. But in terms of economics, yes, it did make the poor a little more poorer, while the rich, and the well-to-do have been less affected. Remember, in my presentation, I said, you lose a job, you lose completely, 100%. There is no safety net. The only kind of support you have is you fall back on the family social structure, which supports its own. Other than this, there is no safety net, there is no welfare check, there is no home for all peoples, or for orphans and so on and so forth. So it is the social system largely that supports. Now, the other question for me is whether there is a plan for mass vaccination and whether there is any deal, for vaccines. Nigeria has no plan of its own for mass vaccination, but the government of Nigeria is also aware that Nigerians may be shortchanged by the international politics of the production and supply of vaccines, of COVID. So in October 2020, President Buhari of Nigeria committed to an alliance called the People's Vaccine, supported by the World Health Organization, which is signed by about 180 countries, with a commitment to vaccinate 20%, of the exposed frontline workers, the elderly and the most vulnerable groups, should the vaccine be ready. And some of the other commitments for the People's Vaccine are to prevent the monopoly on production, to prevent monopoly on the distribution, on the supply of the COVID vaccines, to commit to a fair distribution and allocation of the COVID vaccine, and to provide the vaccine free of charge, and ensure the participation, of the governments, particularly of third world countries, so that the vaccine does not stop, only in North America and Europe. And of course, if the vaccine stops in North America and Europe, and perhaps maybe, Australia and New Zealand, and the rest of the third world countries of Africa and Asia are not on board, then of course, we're just going to recirculate, our COVID around the world, because we will not stop moving either. So thank you very much. I think that's all the questions I have.
Thank you very much, Professor Krieri. So the last time is for Lawrence, but before giving you the opportunity, I'm going to also put one more question, which is actually based on your own presentation, actually regarding the driver for change, which is not quite sufficiently, I think, elaborated in your presentation. So I wonder, what kind of change actually caused by pandemic in Netherlands, and who is the driver? So I also wonder, in your case in Netherlands or also in Nigeria or Australia, is there any emergence, the new kind of populist leader during such crisis, during the pandemic, either at the local or the national level? I wonder, as also now happened in Indonesia, maybe who observe Indonesia a little bit about the, let's say, the cases of Rizik, Habib Rizik, something like that. So the issue of the such as a populist leader coming up and then become the new actor emerging, or even re-strengthening during such kind of situation. So I wonder for, that is my question for Lauren, but it will come for Rachel or Professor Chiari to respond later. Please, Lawrence.
Okay, thank you, Najib. Yeah, you're quite right. I put it in there, but I didn't really discuss it. But it's an interesting theme. It notably came to the fore because when the crisis started, so March, April, this was a very pronounced element in the discussion, because notably the main national airport, Schiphol, had closed. Well, not closed, but there were hardly any flights. And as a consequence, people came to the conclusion like, hey, we might actually in the future have a society in which this way of traveling, this number of flights is actually no longer necessary. And if we're having that, another opportunity might be for people to work more from their homes rather than taking all the travel, ending up in traffic jams, going to their office, whereas they can work as effectively from their houses. So there were all these big new ideas of how things could become better afterwards that were being put forward. Some of those have kind of disappeared. I mean, the main idea now seems to be that after the pandemic, there will be some sort of return to business as usual rather than interesting, exciting new ways of living and working. But notably, when all of this started, there was a strong discourse putting forward like, hey, this is the moment to make change to the economic system, to the social system, and so on. One thing I think I should probably add on the issue of vaccines, that's that also in the Netherlands, government has kind of spread out. I mean, in a sense, it's like investment banking, I guess. They spread the risk. They ordered vaccines from 4 or 5 different producers. Altogether, I think that comes to, well over 20 million doses. So far more than will be necessary. But also, interestingly, yesterday, a discussion started up that for the sake of speed, most of these vaccines will be delivered, apparently, I didn't know that, without a barcode. So without one of those things, basically. That means that if you get vaccinated, it's going to be harder to track what you have been vaccinated with. So the vaccine of which producer and which batch of that. And that is now under discussion, notably from the health authorities, like, is that possible? But because these are vaccines that have been tested but are not that well known, batches may differ, so you may need to know which vaccine an individual has actually been given at this point. So that's basically what's happening here in terms of discussions on the vaccine and where they will come from. But the idea is that vaccination will begin in January, though I know that several batches have already been delayed or will be lesser than intended, so it might very well be a bit later. And that then, of course, brings forth the discussion on who's going to get the vaccines. Originally, the plan was, for instance, to start with the elderly. That plan has now been altered to not start with the elderly, but with the caretakers who take care of them. And my guess is that the discussion will go through a couple of developments before it actually vaccination will start. I'll stop here.
Okay, thank you very much, Lauren. Is there any further response from Rachel or Professor Chiari or no?
No, I'm okay.
No, okay. Okay, I think we still have very few minutes before closing. I wonder if there are any of you, of the participant, going to raise one last question. I will give you shortly if still any. No?
No.
Okay then, if there is no further question or comment from all the participants, I'm going to thank for all the speakers, for this all 3 wonderful speakers, Dr. Rachel Dipros, Professor Chiari Muhammad, and Dr. Lawrence Bakker for very fascinating presentation and discussion regarding the issue of COVID-19 pandemic in each respective country and how the dynamics happen in each of the country. So if we learn already that actually there are some interesting insight and lesson to learn from each country. Yeah, I think from Melbourne, I would like to highlight, I think the interesting, the efficient policy for lockdown, which is quite supported, I think, by communities in general. I think there is little resistance over there. I think also government play quite well in that area, and also the policies work quite well in dealing with the issue, which is, I think, in some ways different with Indonesia in some way. In the cases of Chiari, although I think there is some note on how government and community respond with this, but I think the cases in Nigeria is quite low, quite small over there. So there is no big issues coming up with that country, including in some post-conflict area. And from Lawrence, I think there are some interesting note from the experiences from Netherlands on how actually people responses to the issue of pandemic arrive from the how people are dealing with issue of, let's say, stress, also in the either in the level of personal or in the level of the community. So I think interesting to how to see the moment of pandemic have been a sort of moment of reflection for the country, and also from all of us actually, how to make this opportunity of pandemic become the opportunity to make our life and our world better. So again, thank you very much for all of you, for the speaker and all participants for this wonderful session. I'm going to close this session by applauding for all the speaker and participants. Thank you very much. Yeah.
Thanks, Najib. And it's wonderful to give a talk in English for once. My brain doesn't hurt quite so much. I'm so grateful. Okay. I'm so grateful.
Thank you, Rachel, again,
Thank
Lauren
you.
and Professor Kiari and everyone. Yeah.
Thank you.
All the students and all the participants. Thank you so much. Yeah. See you again next time.
Bye-bye.
Bye-bye.
Bye-bye. Bye-bye. Bye-bye.